welcome to the Nurses Heartbeat. My name is Philip. In this episode, I am going to look at myocardial infarction as part of NCLEX content review, and this is also helpful for nursing students as well. So if you are a nursing student or if you are in the process of preparing for your NCLEX exams, then this is a good content review for you. So join me and let's dive in now. So we are looking at myocardial infarction. So what we normally call heart attack in most of the circumstances. So what is myocardial infarction? I wouldn't be going into so much detail because it is review of the content to give you the points that will be very helpful in your understanding and in your examination as well. So myocardial infarction, a bit of definition, is irreversible damage to the myocardium caused by lack of blood supply due to complete or partial blockage of a coronary artery. Now, when we take the heart, we know there are muscles of the heart, or there are layers of the heart. The three main layers of the heart, we are looking at the endocardium, which is the inner layer of the heart. Then we have the myocardium, that is the middle layer of the heart. And then we have the pericardium, which is the outer layer of the heart. So these are the three muscles of the heart basically. So the inner layer or the middle layer, which is the myocardium, when there is cut of blood supply to this muscle, then the muscle is going to die. So there is going to have the ischemia, that is shortage of oxygen to the blood, to the heart, and then finally there will be necrosis. Necrosis is the death of the tissues. So that is what happens here, and it basically occurs when there is blockage of the coronary artery. So the heart that supplies blood to various parts of the body, the heart itself also needs blood supplied to itself, and that is through the coronary artery. So when oxygen is sent to the lungs, when the blood is sent to the lungs to be oxygenated, then this oxygenated blood is sent across the body for use, and part of this blood is supposed to come back to the heart for the heart to also use, because the heart also needs oxygen. But when there is a cutoff of blood supply to the heart muscles, where the heart muscles will die, then we are getting a situation called the myocardial infarction. Now, we wouldn't go into much of the pathophysiology, but the most common cause of myocardial infarction is coronary artery disease. As I said, when the arteries that are supposed to send blood to the heart itself, for the heart to get the nutrients in the blood and oxygen, when there is a disease of these vessels, the coronary artery vessels, then there is going to be a myocardial infarction, that is tissue death of the myocardium. And when that happens, the myocardium, which is the middle layer of the heart, is the one that is supposed to help with the work of the heart. So if that myocardium is dead, then the work of the heart is going to be truncated, and that is what happens basically. So let's look at classic symptoms of myocardial infarction. Now we have symptoms that are common to men and common to women. So let's first look at men. What are the symptoms of myocardial infarction in men? So we have severe crushing chest pain radiating to the left arm, to the jaw, to the back, and to the epigastrium. So that is how patient will be complaining of shortness of breath. Patient will be complaining of severe crushing chest pain that radiates. It goes to the back, it goes to the epigastrium, it goes to the jaw. They are all signs of myocardial infarction. Now, this is not relieved by nitroglycerin. So when the patient is complaining of chest pain and we give nitroglycerin and it doesn't relieve the pain, then it is mostly a myocardial infarction. And then another sign that it is common is nausea, vomiting, diaphoresis, that is sweating, anxiety, shortness of breath. So these are the common signs that occurs with myocardial infarction or MI in men. Now let's look at atypical symptoms in women elderly and those with diabetes. There are symptoms that comes that sometimes you wouldn't even notice. Okay, so in women and in elderly and in people with diabetes, we have fatigue. People always get tired. We have indigestion, epigastric pain, dizziness, jaw pain, and shortness of breath. These are all part of the symptoms that occur in women, and then you may have silent MI, especially for people with diabetes. You wouldn't really sometimes see the obvious signs like shortness of breath, like chest pain. You wouldn't really see those obvious signs of that one. So sometimes it is silent, but it can present with fatigue, indigestion, epigastric pain, can present with dizziness, jaw pain in women, especially with it presents with those signs and symptoms as well. Now, having known some of the signs and symptoms of this infarction, myocardial infarction, let's look at key diagnostics. How do we diagnose MI? So, if a patient is complaining of chest pain, shortness of breath, then we are going to first do ECG. So, we do the ECG, that is going to help us. And most of the time, you will have the ST segment elevation, what we call the STEMI. And then we have the non-ST elevation, the N-STEMI. So when you do the ECG, it's going to show ST elevation or non-ST elevation. So you may have STEMI or N-STEMI, and that is a clinical sign of myocardial infarction. Then aside ECG, we are also going to take bloods for troponin, TROPS. And then troponin, when it is raised, then it is also a sign of myocardial infarction. In fact, troponin is a very definitive sign of myocardial infarction. And then we can also do creatinine kinase, CKMB, of the myocardial band. So when creatinine kinase, these are enzymes that are released into the bloodstreams when there is tissue death, all right, when there is heart mass or death, we see some of these enzymes. It's not a definite um, test, because sometimes when there is other muscle death, musculoskeletal issues, you could have some of these enzymes in the body, but we still use them to diagnose myocardial infarction. So the last diagnostics that the doctors will want to do is echocardiogram. They will do that to also assess wall motion and function of the heart. So these are the diagnostics. So we talk of the ECG, we talk of taking troponin, bloods, and then creatinine kinase, and we are also talking about echo. So they are very important diagnostics for myocardial infarction. Now let's look at emergency management. What are the ways that we manage myocardial infarction? So for emergency management, patients are presenting with chest pain, they are presenting with shortness of breath. So let's see how we are going to manage ourselves. Patient who is complaining of chest pain, you are going to give pain medication. And here we are going to give morphine to prevent pain and preload. All right. So we want to settle the pain for the patient, and then patient is having shortness of breath. So what do? We give oxygen, right? Good. So oxygen is going to help improve oxygenation for the patient. Then we said that because the myocardial infarction, there is either blockage of the coronary arteries that is preventing blood to flow, for oxygen to flow into the heart. We want to dilate the vessel so blood can flow into the heart muscle. So we are going to give a vasodilator. So we want to give nitroglycerin. So nitroglycerin will be prescribed to be given to also dilate the vessels to allow more blood to flow into the heart. And then sometimes it is platelets that wants to agglutinate, they want to clot in the vessels, or they want to clamp together. Yeah. So we want to prevent clamping of the platelets together. So the doctor is going to prescribe NSAIDs, that is aspirin, to the patient to prevent the agglutination of these platelets. When they clamp together, they are further going to block the pathway or the vessels through which the blood is going to flow to the heart. So we want to give aspirin to prevent that clamping of the platelet. So we call it MONA, managing myocardial infarction. MONA, MONA. So giving morphine for pain, O for oxygen for the shortness of breath, nitroglycerin to dilate the vessels, and then the A is the aspirin to prevent clamping of the platelets. The platelets, when they clamp, they are going to block the vessels and prevent blood flow to the heart. So it is very important that this platelet is antiplatelet, or the aspirin is administered. Now, the other interventions that can be done outside the MONA is the continuous cardiac monitoring. So there is a risk of arrhythmias, especially ventricular fibrillation, VFib. So we want to monitor for arrhythmia. So we want to put patients on continuous cardiac monitoring. And then there should be IV access, so that if we want to give any medication intravenously, we'll be able to do that as well. Then we also prepare for reperfusion therapy. So perfusion of the heart muscles means that we want to provide more oxygen to be supplied to that area. So if the channel or the vessels through which the oxygen should get to the heart is occluded, then we should be able to reperfuse, find a way of still ensuring oxygen supply to the heart muscle. So there is reperfusion therapy that can be done. Now, the reperfusion therapy, we are looking at the PCI, the percutaneous coronary intervention. That is first choice if available. PCI, when you go to the cardiac ward, ACUs, and the rest, they just show PCI. So within the first 90 minutes, if patient is having MI, they are going to do that to reperfuse, to go to supply oxygen to the heart muscles. And then what they also do, another intervention they do, is thrombolytic therapy, TPA. So they are going to thrombolize the system to prevent any clotting that will block the way of the vessels as well. So if the PCI is not available within 30 minutes, we're saying the PCI should be done in the first 90 minutes. But if within the first 30 minutes, there is no access to percutaneous coronary intervention, PCI, then there should be thrombolytic therapy. That is within 30 minutes if PCI is not available. Now, the thrombolytic, because we are going to prevent clots, then we should monitor for bleeding. So patients that are having bleeding, we don't do that in them. So patients is contraindicated in patients with bleeding tendencies, patients with recent surgery, patients that have had hemorrhagic stroke, that is stroke due to bleeding. We are not going to do this thrombolytic therapy with them. Why? Because it is going to increase the level of bleeding. I hope it is clear. And then the other therapy that they also prescribe when patients are having myocardial infarction, we are going to prescribe beta blockers, the bisoprolol, metoprolol, those beta blockers. We are going to prescribe ACE inhibitors, lisinopril, enalapril, and the rest. And then statins may also be prescribed. So statins, we are looking at the atorvastatin, the rosuvastatin, and all the statins, that simvastatin, all the statins that they also prescribe. They are all other therapies or other management that they give for patients who is suffering from myocardial infarction. Now, let's quickly look at what are the possible complications of myocardial infarction. So, within the first 24 hours, there is going to be arrhythmias. So, atrial fibrillation, ventricular fibrillation, that we said the most common one is VFib. So, that is there. It can be a complication of MI. Then there can be cardiogenic shock. So, cardiogenic shock is a shock resulting from an issue with the heart itself. All right. So, shock, we have hypovolumic shock, that is when there is low volume of blood. We have other septic shock and all of that. But when this shock is as a result of inability of the heart to pump blood into the system, then that is cardiogenic shock. In myocardial infarction, there is ischemia of the heart muscle, so they are not able to work. They are themselves dying, so they will not be able to work. So there could be cardiogenic shock as a result of complication. Then there is heart failure. That is when the heart is not able to meet the needs of the body. Then that is heart failure. And there is pericarditis. That is also a complication. The myocardium, when there is issue with that myocardial infarction, then the outer layer of the heart, the pericardium, will get inflamed and there will be pericarditis. And there is ventricular aneurysm or rupture. The ventricle could rupture. Those are the complications. Now let's look at quick NCLEX priorities. So priorities for NCLEX, we are going to prioritize airway and oxygenation. And if patient is having problem with airway and oxygenation, we are going to provide oxygen. We are going to ensure proper positioning of the patient, semi to high Fowler's position. Patient should be in a certain position to ensure expansion of the heart and proper breathing. And then we are going to administer aspirin to the patient to prevent clamping of the platelet and to ensure the vessels are all right for the blood to flow. So aspirin administration is also important priority for NCLEX. And then ECG monitoring, very, very important. Patient is complaining chest pain, radiating here, going the shortness of breath. ECG monitoring is important. And as I said, if it is MI, it's going to show ST elevation, the STEMI and the non-STEMI, or the N-STEMI. And then nitroglycerin and morphine, as prescribed, we are going to administer these medications. They are also very key in patients with myocardial infarction. And then we also prepare for reperfusion therapy, where we are looking at PCI. We are also looking at thrombolytic therapy. And then we are going to monitor for arrhythmias. How do we monitor for arrhythmias? Having continuous cardiac monitoring to monitor for these arrhythmias. So these are the things that we need to know in MI, and then the management, the complications, the signs and symptoms, and then how it comes about. If you have any question, you can put in the comment below. If you like this video, you can share it, you can subscribe as well, and you can share to your colleagues and your friends and everyone that you think it will benefit them as well. I will come again in your way with some NCLEX style questions about myocardial infarction, and you will see how you are doing with it. Thank you for watching. My name is Philip again. I'll come to your way the next time. Remember, every heartbeat tells a story. Bye.